So Lymphoma Coalition has been doing global patient surveys for a number of years. We've been doing them since 2008. The 2024 data, we had the survey open from mid-February to mid-April of this year. We had over 11,000 responses globally from 79 countries. It's a really great data set. It was a 29% increase in responses over the last survey in 2022. And that survey is really, of course, looking at patient experience in general, so when were you diagnosed, struggles with diagnoses, right through to where they are now in their patient experience, but looking at more than the medical of the treatments they've had and the side effects, symptoms, really looking into the emotional burden of having lymphoma, some of the practical or logistical issues they have in accessing care, also looking at shared decision making, what's working for them, what's not, health literacy and how their information level influences how they behave personally with their care, but also those interactions that they have with their doctors. So lots of really cool information coming out of the survey that we'll continue to publish. But the overall survey highlight reports are already on our website, lymphomacoalition.org, if somebody wants to take a look. With that, we do a lot of other research looking into, through focus groups and one-on-one interviews, looking in depth into some of those topics that we see rise to the surface in the survey. So when we see with a certain therapy class, for instance, higher rates of fatigue or higher rates of mental confusion, memory loss, those kinds of things, it's like, how exactly are those things impacting patient quality of life, so that we can bring it back to academia, to clinicians in the clinic, and figure out how can we best solve these issues to give overall our patients a more complete experience, and make sure that some of these issues that may not be top of mind perhaps in clinic are addressed for our patients, so that they're actually feeling as well as they can throughout their care.